Side effects of the digestive system, including diarrhoea, constipation, nausea and a sore mouth with difficulty in swallowing, are common amongst chemotherapy patients. Again, like all side effects associated with chemotherapy, the severity is dependent upon a number of factors. You may receive a specialised set of drugs designed to manage these side effects for your own treatment course, which may be changed depending on their effectiveness. Diarrhoea can be a common side effect of treatment, but it can also be a sign of infection or even an infection itself. Diarrhoea usually occurs within the first few days after you've received treatment. It is worth noting that your diet will contribute to the frequency and severity of diarrhoea, and it is advised to eat less fibre, such as raw fruit, vegetables and cereals. It is important to stay hydrated and replace any fluid lost by diarrhoea by drinking plenty of non-alcoholic liquids. Your doctor may prescribe antidiarrheal medication and give you some additional dietary advice. You must contact your doctor if you are suffering from a fever together with diarrhoea, or if your diarrhoea cannot be controlled with antidiarrheals within 48 hours, and also if you have more than 6 episodes in a day. Constipation is another common digestive side effect with a range of causes. It could be chemotherapy treatment related, a sign of advanced disease, or a side effect of additional medication such as painkillers, anti-sickness drugs and steroids. If it is due to additional medications, then dose adjustments can be made to help control, reduce or prevent constipation. You may be provided with laxatives in anticipation of this side effect, and you should ask your doctor for additional advice. Drinking plenty of fluids and consuming lots of fibre are other useful tips for dealing with constipation. Sore mouth or inflammation of the mouth and difficulty swallowing can occur with some chemotherapy treatments. It usually occurs within 5 to 10 days after the start of treatment and can last up to 4 weeks after you've finished treatment. You must contact the emergency number as soon as possible if you're unable to drink liquids. You may be prescribed strong painkillers if you're having difficulty eating and drinking. Maintaining good oral hygiene whilst you're receiving chemotherapy can help deal with sore mouth. Your dentist may also be able to provide some additional advice. Feeling sick from chemotherapy is another common side effect. However, not all chemotherapy drugs will make you feel that way. For the ones that do cause nausea, you may start feeling unwell shortly after you receive treatment, sometimes within a few minutes and other times after several hours. The duration can also vary from a few hours to several days. It is likely that if you feel sick after the first administration of your chemotherapy drug, you will feel that way after subsequent administrations. It is important to manage nausea quickly so that it doesn't become a recurrent problem. Again, your doctor will be able to prescribe additional medications to manage any nausea and/or vomiting.